Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Huntington's disease. Huntington's disease is actually an autosomal dominant disorder which is a degenerative brain disorder. It is an autosomal dominant degenerative brain disorder. Here, the pathology, if you see, in the pathology, here there is a mutation in the or genetic abnormality is present mainly in the trinucleotide repeat abnormality is important. Here there is abnormality in trinucleotide repeat expansion. Okay, so here there is actually a mutation is seen in CAG repeats, okay, which is present on chromosome 4. These CAG repeats will actually code for the protein Huntington. Because of this overexpression of CAG, there is increased Huntington protein is coded. There is increased Huntington's protein which gets accumulated and resulting in the disorder. So if you see the biochemically, the issue in Huntington's disease is in biochemically the patient will have, there is decrease in GABAergic neurons is seen. There is decrease in GABAergic neurons is seen in the corpus striatum. Similarly, there is also decrease in cholinergic neurons are also seen in corpus striatum in Huntington's disease. Then if you see the pathology here in Huntington's disease, there is atrophy of the caudate nucleus is the main important pathological feature of Huntington's disease.
thank you and thank you for watching.